New tonight, experts are recommending Rhode Island phase out its use of the rapid coronavirus test being offered at the CVS testing site at Twin River in Lincoln after they discovered it's likely to give a false negative result 20% of the time.
State officials say they plan to use the test less and less, but not completely phase it out. Eyewitness News reporter Kim Kalunian talked to the co-chair of the state's Testing and Validations Task Force today. She joins us now live from the Department of Health. Kim?
Well, Mike and Shannon, that doctor tells me people can trust when they receive a positive result from this test, but it's when someone who has symptoms tests negative that it could be wrong. Rhode Island's COVID-19 testing capacity doubled overnight when the CVS rapid testing site at Twin River Casino in Lincoln opened in April. According to the Department of Health, about 23% of the state's tests have been conducted there, but now they're working to use that test less and less. Last month, additional studies emerged and the FDA warned that the Abbott ID Now test that's being used at the site might result in false negatives. We asked Health Department Director Dr. Nicole Alexander Scott about it at the time.
It's exactly what our Rhode Island COVID-19 Testing and Validation Task Force is looking into.
Dr. Angela Caliendo is co-chairing that task force and says they took a close look at the literature on the test.
The sensitivity in some studies is as high as 90%, and in other studies it's as low as 50%. And there's a wide range in between. So the task force looked at all the data, and I would say collectively our conclusion was the test is probably a sensitivity of maybe 75% in widespread use.
So what does that mean? Caliendo says patients and practitioners can trust a positive result from the test, but some of those who test negative might actually have COVID-19.
Do you have any sense of how often it would give a false negative?
When I'd say the specificity is 75 to 80%, that means about 20% of the time it's going to give you a false negative. So the task force did make a recommendation to the Department of Health to try, if possible, to phase out using that test over the next month or so.
The Department of Health says they have already started to move towards that recommendation, but they add the positivity rate for the Abbott ID Now test has been a little higher than the state's overall positivity rate. So there is not a concern about a significant amount of false negatives. And state health officials warn that anyone who's experiencing symptoms, regardless of what their test result says, should be self-isolating for 14 days. I did reach out to CVS as well. A spokesperson for them says they will continue to use this test and any changes made would be done in coordination with the state. Live in Providence, I'm Kim Kalunian, Eyewitness News.